There we go. That's good to see.
Yes.
Hello, everyone that's getting on early. What I may do is go ahead and set up the sharing this time
Mhm.
in advance.
We got some thunderstorms happening here. I hear a little rumble in the background.
Here we have them supposedly coming. So let's do that. Let's do that. Okay, Rob, what do you see on your screen? Do you see it?
I see you to the left, larger than you were, and it's not silhouetted like it was before, where it was just you. It's you with your background, but it looks
Okay.
good. It looks good.
All right. So we'll leave it that way then.
Okay, and I'm also seeing both myself and you and Jim on the left side or the opposite side.
That's interesting. I don't know how we changed
But
that.
but let me log in on my phone and see what we're seeing here.
Recording in progress.
Okay. So what I'm seeing you is on the side and me over here. And Jim, you're still on, buddy. Your video's still on or showing.
I have the camera off. I was just
Really?
putting that up
Cameras?
here just for
Okay.
the background for you.
Okay, cameras up. Okay.
Great. Welcome, everyone. While we sort out some technical changes to the presentation, and then we'll get started in a couple minutes. So now you just see me and the presentation, Rob. Is that correct? You might be on mute.
Mark, I'm sorry. Yeah, I was muted. I'm seeing you twice. Um, both in the center left and upper right.
Yeah, I'm gonna. So let's see here. Yep, I have no other adjustments I can make.
It looks good, Mark. It looks good. Just go with it, brother.
Okay, cool. And we're at 7. Welcome, everybody. Thanks for attending the day before a big holiday. Appreciate you all attending, and we really do enjoy giving these. And as always, if you have any questions, please let us know during the presentation, and we'll try to make sure we address everything. And at the end, you'll see my email. If you don't already know it, feel free to email me. Anything about these topics or anything else around volunteering or the considerations that we end up reviewing.
And also make sure that you post your questions in the Q&A. The chat is disabled.
Right,
Thank you.
thanks. So AirVenture is coming up. It's very close. It's I get there in about 3 weeks. or 2 weeks actually from today. Um, so if you're coming, please stop by. We'll be in Boeing Plaza in the southwest corner where the arrow is. Um, our goal is to sign up 200 new pilots this year. EAA is promoting humanitarian and public benefit flying all during the week. Um, I have 5 different presentation slots. If you're curious when they are, you can scan this QR code. They keep moving things around and doing fine tuning, so that the dates and times may change, which is why I haven't listed them here. Um, the FAA also has a series of seminars are being done in their nice air-conditioned location. A big tip that finding air conditioning during AirVenture is a good thing to know about. And again, if you come by Boeing Plaza and look for us, we'll be there. We have a tent that's not air conditioned, but some cool airplanes, a DC-8, a couple of GAs, turbine helicopter. Wings program, typically every time we review this. If you need information about this, please let us know after the webinar. We'd be glad to point you in the right direction. Today's Rob and I, Jim and Eric, as usual. Brian wasn't able to make it, but starting in August, we'll have 2 or 3 new panelists, and we'll try to make it more of an open discussion around pilots and experiences. It should be a lot more fun. And one of the participants is going to be an AOPA Safety Institute specialist assigned to us. So we'll start having a bit more multi-person perspective instead of me just trying to share information. We already know that it's always rewarding, and we share these experiences to make it safe for all of us. Quite a diverse group of people that we serve. We know that anybody flying anything or driving or donating can make a difference in this space. It's very important to know that anything and everything is appreciated. Sad to say that the Air Care Alliance president just passed away rather suddenly 2 weeks ago. Um, great guy. He flew people, cargo, blood, was based in Phoenix, and had a great saying, which was do as much as you can for as many people as you can for as long as you can. And he was flying up to 2 weeks before he passed. Great guy. We'll miss him a lot. Again, AirVenture, we'll start sharing information about free content from the FAA that not everyone may know about because the updates are not pushed to all pilots. So the Aviation Weather Handbook was updated in 2024. It's a great handbook. It's free. It's got lots of good information, and here's the link to the PDF. And again, the schedule here is here as well. Every month, I try to highlight another interesting piece of data. These are the pieces of the data that I've shared in prior months. This number just came out. 3 million dogs last in 2024 were sent to shelters, and the majority of those did not find homes. So the efforts to rescue dogs and animals of any type from shelters across the U.S. is a huge project still. But it's kind of interesting. The animal rescue locations or the places where animals are coming from pretty much align where there's a lack of healthcare resources. So it must be either rural or socioeconomic or other drivers that we haven't necessarily surveyed yet. But these colors, the darker colors, are where a lot of the rescues originate. Volunteer organizations. We've had a lot of attention to human trafficking recently, and people are becoming more aware of the impact and the size of the problem. So plenty of organizations out there are doing this. Freedom Aviation Network is one. There was a couple of organizations recently highlighted, including one on social flight. If you have any questions about any of these types, again, please email us or just go to the Air Care Alliance website and use the directory.
You can change kids in your community, right where you live, anywhere in the United States. We help you find the kids, you fly them, and you inspire the next generation to pursue aviation and aerospace careers.
STEM Flights is a national organization. We highlighted them in our first month of doing these, and they are now partnering with Aero Educate on many fronts to make it more accessible, or information about flying more accessible to a host of different students.
You can change kids
Oops,
in
sorry.
your community, right where you live.
That. So, if you're interested, this year at AirVenture, Aero Educate has an Aero Educate Center with activities mostly focused on kids age 11 to 18. And if you want to get an idea of what the AirVenture events are around Aero Educate, this QR code will take you to that list of events. It's a lot of fun. I volunteered for them in the past. I fly for STEM flights, very rewarding. And very easy to do because from a pilot point of view, it's a one-on-one experience and it's a one and done. Though I still stay in touch with the youngster that I flew. And safety consideration list has not changed much. Again, one of these days we'll dive into doing each one as a topic instead of the holistic list here. And we can dive right into scenarios tonight. This is an interesting one. And uh, some of us can be a little bit confident once we get used to flying around thunderstorms that, we know what to do, we can get around them. This is an example from that's not mine. It's a friend of mine who had a new airplane and was returning a passenger home from a same-day treatment flight. And what this means is that what volunteer pilot organizations doing medical flights can do is people used to have to drive 8 hours to get to their appointment on a Monday, or to drive on a Monday, get there for the appointment on Tuesday, and then Wednesday drive home. So they'd be missing work for 2 days. And what the plane allows them to do is fly there in the morning, have their appointment, their treatment, and then fly back the same day. So there's a lot of those type of pick up, drop off, and return the same day. And in the summer, that can be, as we all know, kind of challenging because in the afternoon we start having thunderstorms build up. And you start to get confident that you can fly around them or use your tools to figure out ways to get around them. In this particular case, the new plane owner said, I should be able to beat the squall line and I can fly under it. The ceilings are pretty high and I've got dinner plans, so I want to get home. And what some of us do, and I do this as well, is if I do have someone making one of these trips, I may fly them to where they're getting treatment, wait, and then fly back, especially if they're going back to my home base. It just is efficient. So that was the case in this particular scenario. The pilot was confident that it would beat the squall line. In a worst case scenario, would just scud run back to home. When he did his flight plan before departing, and the patient in this case wasn't usually Murphy's Law lives really well on our flights in the afternoons, and everyone's late, giving the thunderstorms time to form. In this case, everyone was on time, and it looked like he should beat the weather, but took off, and it was right away in IMC, and there was not going to be a way to get out of it. So there was no way to see and avoid. Uh, Air traffic control started giving headings to avoid the worst of the weather. And NextRad was giving this pilot confidence that they were going to be okay. And it started getting a little bumpy. And then all of a sudden had a 3,000 foot per minute drop that was unstable, couldn't control the airplane. So rather shocky event for the passenger and the pilot. So lessons learned on this one were pretty obvious, and a lot of us have learned this over the years already. But you can't rely on NextRad for tactical decisions, especially in embedded thunderstorms, and you can't see your threat out the window. Uh, and the whole idea of flying under storms and scud running doesn't work, especially around microbursts. You just can't steer clear. This little picture over here shows you the way that the microburst airflow works on the outer edge of a storm, and you can't see it. So you can be flying into it and have a really unhappy time. The other thing that occurred to this pilot while I was dropping out of the sky is I wonder if the parachute's even going to work in this plane because the downdraft is so drastic. Um, Luckily, in this case, he popped out of it. Was able to level the plane at about 1,000 feet and continued on the flight, but stayed under and scud run the rest of the way. But he flew very low. And he almost decided to stop flying because it was such a drastic thing. Luckily, the passenger uh, flew many times after that and wasn't too upset, but I don't think the passenger understood the significance of the event. So he did well. He didn't panic. He kept his composure. He leveled the plane, and he had a plan that he was going to pull if it was under 1,500, but didn't. He held on to about 1,000, and it stabilized by 1,000 feet. Whether that was prudent or not is another question. Uh, but it's stuff that we don't train enough for when we're doing transition training, and even as we get our license and start doing cross countries, we just can't see enough of these scenarios, and it makes us wonder what we can see in simulators as well, which is another discussion. ATC's heading was based on rain intensity and wasn't really mapping out what was going on around the storm. And we shouldn't be relying on them too much for tactical, especially when it's convective weather. But good example of having a little bit too much confidence and letting the word should, which is one of my favorite things to reference, that if I'm using the word should anywhere in a discussion about my flight planning, then I shouldn't be flying. I do not want to go whenever I'm thinking that it might be okay. So an example, and I'm not sure if we have any questions yet, Rob, but an example that I took from one of the scenarios that was reviewed in the NTSB was someone took off thinking that they could fly below a thunderstorm along a shoreline. And the controller said, okay, but warned the pilot of a significant, heavy precipitation event, at least 12 o'clock and 4 miles, and gave them a route around it. And the pilot looked on that. We don't know this for sure, but did not deviate, decided to just keep on going straight. And they found the wreckage without further communication. So just generally, bad practice to be flying below a thunderstorm without knowing what's above you. And this is the type of thing that can happen to you. Um, the AOPA Safety Institute used to put out a quick reference guide for dealing with thunderstorms. This is no longer on their website. I just happened to have it because I was using it in a safety committee for one of the volunteer pilot organizations I was participating in. And, the radar that air traffic control, again, is so much different than what NextRad is telling us. And NextRad is such a composite and old representation of where the weather is that we need to be not making tactical decisions. And we need to be telling air traffic control what we want to do based on looking out the window. And I can't tell you how many times that I've looked out the window on an approach into an airport, looking at thunderstorms, or even just trying to look at the, convective smaller clouds that are forming around the thunderstorm and just saying, hey, I want left-right deviations. I don't want to be asking you every five seconds for deviation, and really making it a big, big emphasis. I don't want to get myself into IMC if I can avoid it, so I can begin to look out the window or just be dedicated to looking out the window to see and avoid versus being embedded and hoping that someone's giving me enough guidance to avoid. So let's go. No questions on that one. We can divide another interesting one, and this one is me. Had a child coming home from an extended stay, heart-lung issues, traveling with two parents. Not a super long trip, but and it was in an SR-22 at this point. So 6,000 feet cruise, and actually this was in the jet, sorry, but the cabin altitude was 6,000 feet, and the mom was really moving around a lot in the back, and the child was agitated and just looked off, and asked if if everything was okay. offered them a pulse oximeter, which by that point I was always carrying. Um, and then the mom confirmed that the pulse ox was very, very low. And while she was confirming that, got airsick in her coat. Uh, so it was clear that the child was in distress. The doctor probably had not considered the fact that the child would be flying at an altitude of 6,000 feet. And I've seen this a number of times over the years where the physicians forget that they're not at sea level altitude when they're flying. It's going to be, substantially less pressure pushing the oxygen into their system. So after that, in this case, asked for a lower altitude and some shortcuts, and they were very accommodating, and the child was fine. But after that, the child flew with a oxygen generator, which helped make sure that there were no issues of not having a good saturation level. So we also encourage the volunteer pilot organizations to more deeply ask about the ability to fly at altitude when someone especially had lung or heart issues, or even surgery, and more importantly, even surgery. Proactively to ask the passengers to carry a portable oximeter, and then, if possible, carry an oxygen concentrator. Some of us have actually thought about having an oxygen concentrator in the airplane, and there are some piston people I've run into that do that. I don't, but we do have other ways to provide supplemental oxygen, and should it be needed. What we did do well is ask air traffic control for help, and I did have a pulse oximeter, which I'd had for another reason, which I'm not sure how many pilots have done this, but have you looked at what your own blood ox levels are, or your pulse ox levels are during different phases of flight at night and different altitudes, and see if you're staying well in the 90s. Your visual acuity goes down rapidly if you're flying at night and you're at altitude. Even in a pressurized jet, you want to be aware of how your body reacts to these things. And that's why I had a pulse oximeter. So very, very helpful to have, and can be used even when you're not quite sure what's going on.
Hey, Mark, we got a question
Fire away.
from Howard. Even in commercial aircraft, isn't cabin altitude normally 6,000 feet when up at altitude?
It can vary. It can go up to 8,000 at some of the older planes. In my in in my plane, if I go up to 41,000 feet, it's an 8,000-foot cabin. If you're in a pressurized Meridian, and you go to 28,000, you're at 8,000 feet. So it can get pretty high. And again, it varies. 787s, I think they have a 6,000-foot cabin in the upper 30s, which was one of the reasons you feel less tired when you get to your destination in a 787 or more modern airplane. All set?
Thank you, Mark.
So it's summer. Not sure how many of you have sweat 10 pounds off in the plane yet. I've only done it once so far, but it gets really hot. So your passengers get hot too, and again, depending on the health of the passenger, and whether they've flown before or not, and have this expectation of it being hot, you could run into some issues. In this particular case, this was again one of my flights. The air conditioner was broken in the plane I was using. Forgot to bring extra water, and had no pre-flight review of the heat or the hydration level of the passenger. And this was a number of years ago. Ramp temp was way over 110. It was just guessing, but it was much, much harder on the ramp. So and at a runway that was shorter than I normally would be using on a 100-degree day. So managed to get the plane off the ground without any issues, but sweating bullets. Inside the cabin, I didn't put the note here, but it was about 100 degrees inside the cabin. Um, so used most of the runway, got off okay, no, not a big deal. But pretty quickly, passengers were not feeling well, nauseous, and the temps had not come down much. Um, and what do you do? It's not making for a fun situation for anyone. It's distracting. So right after that, I really suggested to the volunteer pilot organization as well as me that we really need to understand heat exhaustion and impact on our passengers. We don't get training on this in the normal course of flight training. They're just looking at our proficiency, not how well we do with passengers and making sure the passengers are safe. Um, so in this case, my passengers were experiencing nausea. They didn't feel well. They weren't vomiting yet, but they clearly were not in a good place. And luckily, again, the flight was relatively short, so we were able to get on the ground before it got much worse. But it is conceivable that it could have got much worse during the ride, uh, and even impacted my ability to fly the plane proficiently. So after that, always extremely disciplined about bringing extra water, extra cooling devices if I could, if I needed to. Um, and I did set a rule in this particular case that I would not fly the plane with the air conditioner broken on a hot day. It just wasn't worth the impact on myself or the passengers. Um, and prior to that, I just was used to sweating to death at being part of the pilot dues that we pay to fly. So something to be aware of. This QR code brings you to a good discussion of the heat issues. So all set, Rob?
Yeah, I got a question for you, not related to this, but the previous slide. Thomas asked, is there a usual or normal decrease in O2 saturation per 1,000 feet for a healthy individual?
It varies. And a great question. I don't know if you guys know what the PROT is, but it's a or it's a portable. I forget what the acronym is for, but it's a portable pressurization chamber that the FAA takes around the country. And if you see one of these sessions being offered at a local airport or anywhere, and you have the time to go to do it, it's extremely worthwhile. So basically, you go into this chamber, which is just plexiglass walls, and they reduce the pressure in that chamber all the way up to 28,000 feet.
Well,
And
actually, Mark, I just went through a session on that, and they don't do that anymore. What they
oh,
do is just reduce the oxygen level.
oh, that's right. That's how they do it in the
Yeah,
clear.
they've
Yeah.
changed it. And the Pro is going to be coming, I believe, to Brainerd Airport in 2026. We're going to try to
Oh,
get that
okay.
here.
Yeah,
Yeah.
they take it all around the country. It's at Oshkosh or AirVenture in the FAA
Yeah.
building as well. So yeah, if you don't have a chance to do it locally, do it at AirVenture. It's definitely worth it. But it takes you on a journey of seeing how well you perform at these different altitudes. And there is one pilot trainee who was acting normal all the way up to 28,000 feet, which was crazy. And the rest of us had, stopped being proficient at drawing and writing things down, much before that. So I don't believe there's a standard that anybody can give you that says you're going to lose so much oxygen. Your blood oxygen is going to drop on a certain schedule. For me, when I get to 8,000 feet, I'm around 90. So I can tell that if I'm flying the plane at 8,000 feet, cabin altitude in the jet or in a SR-22, that I'm going to be more tired and want to get to the destination. And I definitely don't want to be doing that at night, without having supplemental oxygen. So that's why it's important to know to get one of these meters, and there's cheap ones and then there's medically certified ones that they're all going to be good enough to really give you enough feedback to learn what your ranges are and what's going to make you feel comfortable. But it's a good, great question. And it's really humbling to put yourself in one of these Prote devices, which are totally free to go off and do, to learn how you're reacting and how it impacts your ability to do even basic things. So, yeah, good question. Big, hot topic. It's going to be always there. So we went over the hot passengers. Again, we don't train enough for this, but yeah, I always wondered when I was in a 100+ degree airplane how it was impacting my proficiency. We had this is a scenario that we reviewed in the very first session 5 or 6 months ago, and it was about bad timing for air sickness, and the there was two families, and this is me again, two families that I was supposed to be taking from New York to Virginia. And it went from being an afternoon flight to a nighttime flight. Um, it was a pretty warm day. These are not their pictures, by the way. And they were late. So it became a night flight. Uh, Kids had not eaten dinner. I had not thought about any of that. I had granola bars for dinner while I was waiting and did not ask if they had a drink. All I cared about was making sure that everyone had gone to the bathroom. Um, and, both children got airsick on turn to final. And then one of them got airsick again on a short final, and it was one was a mother son, and the other was a father son. So the father of the son was in the co-pilot seat, decided that he was going to get up and try to get back and deal with his crying, throwing up child. So not very, all not a good time for any of this to be happening. Not anything that I had ever experienced before. Definitely startling, distracting. I had not briefed them on anything other than, sterile cockpit and staying in your seat with your seatbelt fastened. So clearly there was a lot of things happening in ways that I wasn't used to them happening. Um, so this sort of is getting back to the point about knowing whether your passengers are hydrated, whether it's warm, and whether, and that's really going to necessitate good hydration, and whether they're fed. Um, and that would have made this a less startling event. Uh, so in general, environmental things that we generally aren't trained to think about need to somehow make it into our checklist or our consciousness about what to be sensitive about, whether it's family members or any of these medical patients. Um, so in my case, after all this startling and it being a long day, I just stayed overnight and said, that's enough. I'm not straining myself anymore. And those kind of things are also very important to assess is, when to call it. Even though your ego may say, oh, it's only a short flight home or something like that, it's much cheaper to not cheaper, but safer to be staying where you are instead of stretching your duty day. Uh, so I also now brief distractions. I added that to my pre-flight briefing, even before they go to the airport, saying some things may happen during the flight that could be distracting to you, but understand that we want to minimize interruptions for the pilot. So if it's not, an emergency, try not to bother the pilot. And depending on the type of illness of the passengers, I can get more detailed about what I'd like them to be checking or dealing with on their own versus interrupting. Obviously, flying turtles or animals, not quite so bad. So, Rob, how about on this one?
Yeah, Paul mentions, what about adding airflow into the cabin in such a situation?
Airflow helps.
Yes.
And if it's in the last 2 minutes of the flight, that doesn't help much,
Mhm.
in this case. Very busy time to be dealing with things. And depending on the type of airplane you have, it's not like that blast of air that you get out of a piston plane when you open the vent, and that has been closed. But airflow does help. It's very good to do. When I'm flying the SR-22, I'll try to have a lot of vent going all the time. And I think I've got nothing scientific to say that it does make a big difference, but I'm more comfortable, so I'm assuming that the passengers are more comfortable.
Got a
So
couple more questions. Thomas asks, have you formalized a list of pre-flight debriefing items for your passengers?
yes, and I think we blew through. I took away the slide that had the AOPA list of pre-flight briefing.
Mhm.
So I have my own, and we encourage you to develop your own based on how you operate your plane in general. So one of the things when I had a Meridian for a couple of years, and I had taken that checklist and turned it into a 5 by 8 index card with very short words. And the things that I would sometimes forget, I highlighted in yellow, and I put it on an articulating little clamp that was always on my glare screen, so I could very easily check it without having to look away from the panel or outside the airplane. And as I started flying medical patients, that was the first plane I was using mostly with doing volunteering, uh, I added another one of these cards with the things I was asking passengers, and I developed my own written list that I would go over on the phone when I called them for the pre-flight check-in. Um, but
That's
one of the other challenges is, for me, I evolved to take a lot of last minute or problem flights where someone had a breakdown, or someone had called at the last minute and they were trying to fill the flight, and that often cut out the ability to have a pre-flight call. It was you're just showing up. So sometimes I was learning on the job, but oops, I should have thought to ask this particular type of question. So, good
okay.
question. Most of the organizations have some mentors that can provide you with examples of their checklists, or you can email me and I'm happy to share what I have.
Right. I was just thinking there might be templates that are available.
Yeah,
Uh,
the AOPA one is a good template.
yeah. Okay. Andrew asks, what is the suggested protocol if you need to land with a medical emergency and need to get emergency services immediately?
Uh, to, so there's two issues. One is um, never hesitate to declare an emergency. So declare an emergency. Air traffic control will ask you something that you're not usually trained on, which is how many souls are on board and how much fuel do you have. And they want to know in terms of gallons. If you tell them in terms of hours, it doesn't mean much. So they want gallons or pounds. Um, and if you don't say something, usually they'll ask you if you need assistance, and or they'll ask you intentions. So you should be prepared to say, I want to go direct to the nearest airport with services, or I want to go direct to the nearest airport, period. Or I want, think through the type of ask or answer you're going to give to that question. What are your intentions? Um, so in some cases where I've had to get on the ground in a hurry, I just say, I want to go any airport. I don't care. I'd like it to be VMC. And that's worked out. They'll do that if there is a VMC airport available. In other cases, I've asked for, I want to go to a specific airport because I knew there were services there and it was reasonably close. And I got on the ground very quickly. And in that case, air traffic control had declared an emergency for me because I was so busy dealing. This is where I had multiple avionics failures going off at once, um, and trying to figure out what was going on. So in that case, it worked out. I got to a place that had services, got on the ground actually very quickly, and that worked out. And then another case where there was a seizure baby, which I'm not sure we've gone over this one. Uh, and this was a pilot that I had handed off a family to finish their final leg home, and the baby was having epileptic seizures, and the parents were going crazy in the plane. So he didn't care if the airport that he was going to had services, he just wanted to be on the ground. So he was pretty clear in saying that, saying, you know, and he didn't give fuel or and according at least when I talked to him, he said, "Look, I just told them, hey, I'm having medical emergency. I want to get on the ground at the nearest place. I don't care where it is, just point me." You know, and air traffic control can be very, very accommodating. You know, your PIC, you get to say what you need and what you're willing to focus on. And, you know, if you don't have time to figure out where the fuel gauge is, you know, they'll survive without you telling them how much fuel you have. I shouldn't say that, I guess, but you know, you know, you're in charge. So, um, yeah,
Couple more questions, Mark.
sure.
Vladimir asks, if you need to make a safe no-go decision, who pays for the transportation and accommodation in a volunteer flight?
So the passengers almost always have a plan B, and most of the organizations will say, "Hey, we'll tell the pilot, hand off, you know, call the you know the organization if this is happening in real time." And depending on the organization, they'll pay for accommodations and sometimes the travel, uh, and not always, but in most cases that I've seen. And for your if you're staying overnight because you had a mechanical or something like that, that varies by organizations, but most of the organizations will underwrite that as well. Um, and I've had a number of cases where I've, you know, just said I'm not flying back to the squall line, or I'm too tired, or you know they've been too late, or whatever, and I've just stayed over. And in those cases, I've just paid for it. Um, and sometimes I've gotten you know, a little cash card in the mail from a volunteer pilot organization, you know, giving me something towards my expenses, which I didn't ask for. So again, it varies, but it's a good question. So the passengers you should never have to worry about. The organizations will take care of them. That's what they're there to do. Uh, and it doesn't mean that if you want to help, you can help. You know, I've flown, I think this was one of the scenarios I've flown to try to beat a squall line because of late passengers into Ohio to get to a one-of-a-kind hospital for the type of treatment this one passenger needed. And you know, it was clear since they were late getting to the airport, it was going to be very close for me to beat the squall line. And I was maybe 30 minutes too late. And they closed down the main airport in Cincinnati and then the little one, Lunken, that I was trying to get to. But I knew from prior experience that Lexington, Kentucky wasn't too far away, and the tail of the squall line had not gotten there. So I would just barely beat it there, and it was only an hour and a half or so drive to their hospital. And I just paid, I said, "Look, we're going to land. I'm just going to rent you a car, and you know, I hope the appointment goes well." And I stayed overnight. So it made it very simple for them. They didn't have to check in with the organization. Um, and you know they made it to Cincinnati without really any additional drama. And there was really no drama on my flight. They landed, it wasn't even raining yet, so it's a very, very calm experience for them. So it's again, a lot of it's common sense as well. Just, you know, use good judgment on what you want to do and know that these organizations are behind you to support you and support the passengers.
Thank you. Bill is asking if they're recorded. Bill, they are recorded. These sessions are recorded. And how can he view them?
Sure. So there's a couple of different ways. The Air Care Alliance has a YouTube channel, and we're posting them there. The Air Care Alliance also has a pilot section with safety section below that, and we're posting them there. And then if you want wings credit after the fact, we're posting them on Social Flight. In the upper right-hand corner of the socialflight.com website, you'll see the FAAST logo, team logo, and under there you'll be able to find the webinars. You have to take a little quiz at the end. Cool.
Validate knowledge, yes. Michael asks, related to medical emergencies, what is your advice on maintaining focus when distractions, in other words, passenger distress, in the cabin becomes difficult to manage? Good question.
It is a good question. Again, not something we train for. So, um, it's so a lot of the organizations have a pilot orientation process. You have to apply, and one of the steps is to go through a onboarding orientation, and that's usually done with a pilot or a member of the team that has been around a while, and they'll go over these type of questions and issues, but it's not going to be I don't want to say this incorrectly. It's not going to be 100% effective if you wind up in one of these situations. So when you sign up for a medical, you'll see most of the organizations will tell you what the affliction is. So you'll know, is it cancer? Is it burns? Is it, coming home from surgery or coming home from treatment? Or is it just going to and from a quick doctor follow-up for a heart transplant or something like that? So you will be able to get, to do a fairly common sense level assessment of how ill the person is that you're transporting and the potential for some kind of interrupt and distraction. That assessment's not going to be perfect, uh, but it will at least give you some idea of what to expect, and then you just need to know, work through how you want to deal with that. So if you have someone that starts getting weak in the cabin, you know, are you going to be okay? Um, Rob, do you remember, did I go over the screaming baby toddler
Yes, you had. Yes.
scenario? Yeah, so I'll go over this as an example. And this is probably, except for the seizure example I just gave you, this is probably one of the more distracting examples. And I don't know how you prepare for this. So, and I'm happy to talk to anyone afterwards, by the way, that wants to talk about mentoring and how you prepare for the different scenarios. And that's why, and by the way, that's why we're doing these webinars, is to share this kind of information. So, and so in this particular case, first time little guy, brain cancer, going from Midwest to New York City to see a specialist. Mom has a newborn, is traveling with newborn. Uh, Father has to stay behind and work to maintain medical insurance. 3/4 of the way into the flight, the toddler starts blood-curdling screaming, agitation, won't calm down. Mother can't calm him down. And air traffic control is, it's very distracting. Air traffic control is hearing this as I'm talking to them. And so they give me direct to the airport, any runway I want, as fast as I want, anything to get me on the ground. So in that particular case, I became distracted without knowing I was distracted because I just said, "Oh, this runway's, I think it was 27 or something, and this is to White Plains, New York, if anyone knows White Plains. So there's a short runway, and this was straight into the short runway. And I said, "Oh yeah, why don't I do that?" No, I've never landed in going that direction at White Plains, and the wind's not necessarily favoring that runway, but I should save maybe 5 or so, maybe 10 minutes at the most, by not flying in and using the approach that they were advertising on ATIS. And I did that, and I probably shouldn't have done that because it was a downsloping runway. I was on the verge of having a tailwind. I used the entire length of this runway, um, and that was before I had anti-lock brakes. So I kept wondering whether I was going to, blow my tires by braking heavily, and you know, turned off at the end of the runway without incidents. As soon as I turned off, the child stopped screaming. So, um, it's one of those things where you don't know how you're going to react until you're in the situation, but it's important to chair fly. And I say this a lot. It's the only way that I catch myself saying, okay, what could I have done better in this last flight? And I'm going to go off the question a little bit more here is we can learn a lot from the airlines. A lot of it's way over what we need, but there's this format that we're doing in scenario reviews is based on United Airlines, and United Airlines has all of its pilots have an extra card on their lanyard, and it's a safety card, and it goes and it, after every flight, after every single flight, they do this assessment. What went well? Why did it go well? What can we do better? How can we do it better? And that's just their religion. They have to do it every single time. And we're never being asked to do that, but we should be asked to do that, at least for ourselves and during our BFRs. So that's what I'm trying to do here is, and these are things that I've chair flown. I've chosen to write them down, and I'm trying to be brutally honest about, when I probably could have done something. There's always something to do better. But if you guys can start adopting something like that as well, I think you'll be better pilots. So how are we doing, Rob?
Good safety management systems, continual
Yeah.
improvement.
Yeah, it's good.
Good stuff. Good process, good procedure.
Keep on going.
Yes. Well, I've got a couple questions, but let's do another scenario. We'll come
Yeah,
back.
I'll do another scenario. Yeah.
That sounds-
So this is a really novel one, and um, one of those examples of again picking up a flight last minute because somebody else had a mechanical, uh, and I was told the passenger had a vision problem, but wasn't told that they were blind. So, so the definition of vision problem, this is several years ago. So it was the first time flight and for any kind of flight for the passenger flying, and I had been told that they would be accompanied by someone, and they were trying to get to Boston for a 9 a.m. Monday appointment. So I didn't have time for a pre-flight call. I had to fly 350 miles to go get them. They're extremely rural, so it's an 8-hour drive to get to Boston. Uh, and this person got to the airport by a local cab, where in this part of the state of Maine, there's only one cab. So that was kind of novel. So whenever this is early into me doing this, but whenever flying someone for the first time, I would try to strike up a conversation and say, "Oh, where are you staying tonight?" And see if I knew where it was, and say, "Oh yeah, that's nice." And how are you getting to the hotel? And um, how are you getting to your appointment? And where do you think where are you thinking of eating? Um, so in this case, this person was traveling alone, totally blind, no companion traveling with them. Uh, and I started asking, saying, "Oh, where's the hotel?" Uh, what do you mean hotel? I'm staying at the airport. And I said, "Well, where at the airport?" "I'm staying at the airport." I said, "Well, who's coming to get you?" "They're coming to get me." What do you mean? And so I drilled down on each of these things. There was no hotel, no ride to a hotel, then no ride to an appointment, no food, no one dealing with, at all addressing food. And when I asked her how much money she had $20 in ones, and no plan B if she were not to get there. The volunteer pilot organization, unfortunately, that day didn't answer their after hours phone number. Um, and luckily, I had a co-pilot with me on their first flight, mentoring flight, uh, to deal with the passenger while I was trying to figure out what to do next. So luckily, in this case, it was going into Boston Logan. His signature FBO was very used to seeing these patients come through that had special needs, not like this one before. And there was a hotel, literally a number of hotels in Boston, and there's ways to get them fed. So Signature arranged to drive this person to the Hilton. The Hilton agreed to accompany this person to check in, to a room, to get fed. They didn't take responsibility for clothes and anything else. Um, and they said they would get her to her appointment one way or the other. Uh, So I moved the co-pilot to the back of the plane to sit with this person so that they wouldn't be alone and they would have someone to make sure they could exit in an emergency. Um, and then we took off. So, um, do better. Definitely we needed to, the volunteer pilot organization needed a much better description of what a vision challenged person was. Um, we also needed to implement something that said they must have a companion, similar to what we eventually implemented for people that had amputations. Um, and make sure that the hotel, food, and transportation had been fully vetted. In this case, the volunteer pilot organization had said we asked her companion in Maine whether they had made arrangements for staying over, food, and transport, and that was vague enough for them to answer yes, not knowing what they didn't know, the people in Maine, and uh, specific enough for the volunteer pilot organization to think that they'd gotten an answer that was, yeah, everything is all okay. Um, and it got to the point where we just cannot skip the pre-flight call as a pilot. We really need to be making those calls. And I've been caught in a lot of these scenarios, or where I've been caught not having the opportunity to do a pre-flight call and get some of these questions, answered and confirmed beforehand. In this case, took responsibility for problem solving before taking off, instead of trying to figure it out en route or on the ground. And once we got there, and again, made sure that the passenger would have adequate support for getting out of the plane. So not sure if there's any questions on this. This is pretty unique, and this was a number of years ago. So since then, a lot of the organizations have gotten better at this. But you can still find yourself in one of these situations where, what do you do? Do you get caught up with get their itis, or do you say, hey, this person's is not a life or death situation for this person. They should just stay behind, and we should sort it out later. Oh,
Yeah, I've got, of course, some questions here.
sure.
Do you have an in-flight medical emergency diagnose kind of checklist or quick reference list too?
No.
Okay.
There's, at least I don't. We're not medevac flights, and our passengers are vetted and have a doctor's release to sign saying that they're stable enough to fly. So
Mm.
the scenarios, the screaming kid scenario or youngster scenario, that would not have been caught by a liability form or a doctor's release.
Mhm.
The seizure event with the baby, that should have been caught. The fact that the child was having seizures at all to begin with should have made it a questionable flight, because pilots are not, none of us are trained to deal with that kind of emergency. So I can't tell you. The number is tiny, extremely small. I can't tell you an exact number. I'm a scientist by training, so whenever I can't give an objective answer, it bothers me. So in this case, I don't have enough data to tell you how often that, in-flight emergencies as volunteer pilots happen, but it is extremely small. And no one should be expecting us to diagnose in the air. Our job is, if there's any kind of startle, distraction, anomaly happening, get on the ground. It's a lot better to be on the ground having the discussion than it is in the air.
Yeah.
And there are so many airports, especially, or for most of the US, that are near to us, that we can get on the ground in a hurry.
Thanks, Mark. Steve asked, because these passengers are ill, what sort of protection does the pilot need to have, if any, mask or other PPE?
Good question.
Yep.
So let's go to the extreme. During COVID, um, a lot of the volunteer pilot organizations stopped flying. They didn't want to be responsible. And then when they started flying, they wanted everyone to be wearing a mask, even the pilot. Everyone had to have a mask on. Um, and now it's really discretionary. Again, you can see the affliction, and the doctors that are signing the medical release, they're not going to put someone contagious with in a small plane with you. They're not going to sign off on that. So I can't think. I can in the last year I've maybe had only one person wearing PPE. And that's because they were immune compromised. So it's not that the pilot and co-pilot are at risk. It's more is the patient at risk catching something from the rest of the people around them.
Very good. Thomas asked, do you ask the parents or other details of the passenger with medical issues to make sure that the agency gave you all the information?
Yes. And again, the agencies have gotten much better over the years.
Mhm.
Some of the agencies have been around 30 years, and most of them are more than 10 years old. So a lot of these have gotten better at disclosing things that you as a pilot should know about taking care. But these scenarios that I'm presenting go over the things that sometimes slip through the cracks. And those can be, uh, parents, the parents may not tell you that the child has a feeding tube, and they may decide to feed the child while they're in flight, and you may glance over your shoulder in the back seat and see, tubes and stuff and things leaking on your seats that you just didn't expect. So again, pretty rare. Most of these kind of things are caught with the intake process. And most of the offices now see if it's a certain type of condition, they know what additional questions to ask. And that's just experience. So you shouldn't be surprised. And if you have a question, when you see something described, just ask. There's no reason not to ask. And the office, a lot of times, if they don't know the answer, the offices follow up and get you the answer.
Very good. Very good. Scott asks next, are these flights typically required to be planned VFR or IFR flights?
Depends on the organization.
Mhm.
Um, excuse me, we're actually jumping to the near the end here. So most of the organizations want you to file an IFR flight plan if you can. Um, and but there are large organizations like Angel Flight West that allow you to be a private pilot without an instrument license, and you do not have to file a flight plan. They encourage you to fly a minimum of VFR flight plan, but again, there's no requirement. So when you go through your orientation with a specific organization, they will have their rules and policies in that orientation, and there will be a pilot operating handbook for that organization.
Very good. Jason asks, I think most organizations will list the ages of the passengers. For people starting down this path, you may want to limit your passengers to adults. Build some time managing fewer issues before uh, tack tackling an unknown.
Right. It all comes down to what you're used to. Very good question. So the technology, a lot of the medical organizations use the same technology called VPOIDs, or something that was built to look like VPOIDs, which is a weird name, but it's Volunteer Pilot Organization Information Data System. So, and that will give you the age and again the weight, and some of the organizations actually give you the height, so you can figure out whether you need a seatbelt extender or not. Um, Now, whether you fly little kids or not is up to you. Um, I found flying little kids fun, and I right away migrated that way. Um, a lot of people like flying only one person at a time, and maybe that's also because of weight and balance. But dealing with one adult at a time is certainly a lot easier and gives you typically the ability to bring a co-pilot. And it's always better to have a co-pilot with you. That's another pilot. It just can, take a lot of the pressure off. And the distraction level will go down if that co-pilot can deal with the passenger if there are any questions. So, good point. Try to find a profile of, hey, I want to take someone that's going for, broken arm, treatments versus cancer treatments, or, an affliction that I'm comfortable flying. Because you may have remembered one of the other scenarios where I said, are flying children with 75% burns. You need to have a certain, strength to deal with children that are ill. So, that's a hard thing for you to self-assess. And you don't want to be self-assessing it too much at the airport. You want to be doing it, when you're selecting a mission. So I think we're about to go over, but I can squeeze in one or so more questions. But I don't want to forget to say thank you guys for doing this because it's important to know that the community is interested in learning more. And please look us up at Oshkosh. I'll be there for actually 9 days, but have 5 speaking slots, and we have that tent. I'll be in the tent most of the time on Boeing Plaza. So, any more quickie last minute questions?
There's been a discussion about ATC and FAA Order 7110.665 BB, which talks about what is required, I guess, when you're in an emergency, what's required to be talked about. Do you want to just go over that a little bit more, Mark?
I unfortunately, I generally know that section, but I don't know it specifically by heart. Sorry, guys.
Yeah. Well, maybe we can follow up with an email to everybody, clarifying that a little bit.
I can, and I can just make it. I'll just do it in the next in the August webinar.
Great. That
Yeah,
sounds good.
Yeah. And sorry, I don't have it memorized.
Yeah. Bob, thanks for your information on that. We'll take care of that and add that to the next webinar. Great.
Yeah, for sure.
One final question, quick one. Should all passengers have an assistant?
No.
Okay.
It really depends on the affliction. I've flown many people that do not look like they're ill at all, even though they're in stage 4 cancer. They're moving, they're talking, there's no mobility issues. And they clearly don't, they have no problem stepping up over a wing, getting out. So it really just depends. Especially if someone has an affliction like being blind or a lot of amputations and they can't operate a seatbelt or open a door, those people should have a companion. And most of the organizations know these scenarios now and are trying very hard to make sure people that need a companion have one.
Very good. So there's a few more questions, but why don't we just address those individually afterwards? Does that sound good?
Yeah, unless there's any like really great nuggets in there.
All right, we've got one here from Henrik. For these kind of flights, is there any special insurance needed?
No. The organizations have a certain minimum that they like to see, which is 100,000, a million of overall liability, 100,000 per seat, but that also varies by organization. And then the FAA Reauthorization Act of 2018 added a Good Samaritan type limit on liability for pilots, which means that beyond your insurance coverage, you should have no liability. Now, whether that's really not been tested in court anywhere yet. But the intent was to make it so that you never have, anything beyond your insurance limits as a liability.
One other question. Thomas asks, I'm assuming we should require flotation devices to be worn on overwater missions.
Well, again, that's going to be just, based on the FARs anyways. I mean, if you're beyond gliding distance, you're required to have them, or depending on the type of plane that you have. I've flown, yes, I've flown over water straight into the Atlantic Ocean to avoid thunderstorm line and then way beyond uh, glide distance. And then luckily, in that case, already had flotation devices and a raft. So you just have to follow the FARs and you should be fine.
Excellent. I think that wraps it up. We've got some thank yous. One last question just popped up. Verify that passenger understands limit on luggage, both volume and weight.
It's one of, yeah, we have a scenario, we have more than one scenario on that. We'll have one of those next month as well, but have a lot of examples of where they've deviated or where they've unintentionally deviated, like, a baby stroller that weighed 100 pounds that, you didn't even know they made baby strollers that weighed 100 pounds, things like that. So, but those kind of things should always be listed on the comments or the itinerary for the passenger. So
Yeah.
great. Thanks, guys. Hey, this is
You.
great doing. Enjoy your July. Hope to see you at AirVenture. Fly safe. Thanks.